All right. I'm sitting here with Dr. David Todd, and he's a sports chiropractor here in Birmingham, Alabama. I'll let him introduce himself properly because I definitely won't get it right. So if you could just do that first, and then we'll move on to some of the questions and answers.
Okay. Well, hello again. I'm Dr. David Todd. I am initial chiropractic degree, then did a fellowship in sports at Sport Tech International for a year, then did the certified chiropractic sports physician, then later on training with the diplomate in sports.
All right.
So I've been practicing here in Birmingham for 27 years out of the 28 years of practice after that fellowship.
Gotcha. And so full disclosure, you've helped me personally with a concussion, and feel free to talk about that a little bit, how I came in versus the person I am now, who you met the first time, the person you've met now, as far as I had a post-concussion syndrome, and you helped me with that. So if you just want to, from a doctor's standpoint, in that view, describe who you met and who I am now.
Certainly. Michael, the way you were before, okay, you were not multitasking very well, you had a very blank stare, not very organized with your words. You actually could not even fully finish a sentence without either thinking of a word, stuttering, or saying the wrong word. And even as I noticed earlier, when you first came in, you kind of left the tables and the laser goggles and everything just kind of haphazard on the table. Now you folded the towel nice and neat and you put the goggles right in the front. And then now you're speaking a lot more clear, your eyes are more open, your facial expression is a lot more, not necessarily genuine, it's just not faked anymore. You're not having to fake it until you make it like you were.
Oh, yeah,
That's
absolutely.
one of the main things that we noticed.
Right. And during the process, I can say on the patient side, it was very, I guess a better way of saying it is I've been through a lot of different therapies. So it's kind of like you start off like, oh, wait, this is going to be great. And then, not so great. But this, I definitely noticed the transition. And I could notice good days, bad days, and in a good progression, of getting better. I actually could tell the difference myself as far as I was feeling. There were some days where I wasn't as good, and then other days I was feeling much better. And then now I'm a lot more even keeled. Yes. I guess I could say would be the best thing. But one thing I did notice, or do remember you saying, was when you did one of the tests on me at the beginning, it was a neurological basic exam. Is that what you called it?
Yes, it was kind of whether you're transitioning properly between fight or flight and rest and digest. So your brain was too fast. Other people's, their brain is too slow. We wanted to be able to get you to be just right.
Gotcha.
Therefore, you can multitask better. You can handle stress more appropriately, process, and get your day done.
And one thing you did say to me was, when you did those tests, you said the good news is this is not permanent.
Correct.
And how did you know that?
So only the good Lord has a working crystal ball. However, we can tell what is permanent and what is not permanent as far as neurological conditions, because if we test, find a weakness, then use the laser on the appropriate part of the brain or the appropriate part of the body, and that weakness goes away in a matter of seconds, we know it's not permanent. Or certain things within a 2-week period, if we can get them to stick, they're no longer having balance problems, weakness and extremity issues within 2-week period, we know it's not permanent.
All right. And one thing I noticed is I've had a couple of neurologists, and not a knock against neurologists, because they definitely have their place, but they basically, well, not basically, they told me there's pretty much nothing we could do for you. You're in the wrong place. Yeah. But one thing that puzzled me was they're a brain doctor, and the test that you did with a pen, and you determined my weaknesses with a pen, with you moving your pen around. Right. And I would assume that a neurologist would know that basic test. However, is it because they weren't a functional neurologist?
A little bit. Okay. First of all, neurology, an amazing field, wonderful specialty, especially really, really good at specific pathologies of the nervous system. That's what they do. And then you look at them finding the weakness or the condition, and what tools do they have in their toolbox to help.
Right.
Most of it's medication, and then send out to physical therapy.
Yeah, and that's what they did tell me. The one doctor did say, or the neurologist did say, all I can do for you is try different pharmaceuticals until we find the right combination that works for you.
Right.
I didn't want to do that personally because I wanted to stay away from pharmaceuticals. However, if I would have had to, I would have done it.
Yes. But
I didn't feel, I felt there was another option for me. And one thing I did like about your treatment, it was a combination of knowledge, the physical side, with actually physically working on my neck and using the laser. Can you tell us about the laser for just a second as well?
Absolutely. And that tool that I mentioned in my toolbox, because there's no technical pill for the brain. Okay. There's nutrition for the brain, and then there's low-level laser. Okay. So when I say there's no pill for the brain, there are anti-anxiety, antidepressives. There are very specific mood-altering medications, but for actual brain function, the particular laser is the only one that can be used directly on the brain and clear up weaknesses that are not permanent.
Right.
So it's about recapturing those basics. And to explain their approach a little bit, nothing wrong with this because that is in their scope of practice and it's amazing. However, my mentors and teachers steered me in a great direction to be much more functional because they say if it doesn't work, you can't call it functional. So we do all the same neurological tests like you were mentioning earlier. We do follow the pen for eye movement. We do the pen light. We do all these different reflex testing. However, for many, many years, it's very, very frustrating to do a test, then find a weakness, write it in a chart, and kind of cross our fingers and hope it would wake up later. That's still the traditional model at this point in neurology. For us, we have blessed to have the particular low-level lasers to be able to go to that specific part of the brain, that specific body part, even if it's an emotional weakness, okay, to be able to help clear that up, to recapture basics, start moving them in the right direction today. So it's no more wait and see approach. That's the difference between their focus or their approach and ours. We just don't have the time for that.
Right.
We like to take the simple time to get patients better more quickly if it's not permanent. And there are a lot of permanent conditions.
Right.
We've seen a lot of permanent in Parkinson's, MS, ALS, Lou Gehrig's disease, certain types that. However, not all weaknesses are permanent. They're just assumed to be.
Yeah, and that was one thing that I did because I went to I tried going to a mental health therapist, and she was great, except her whole approach was kept trying to talk to me as if this is the new norm, and my acceptance of this being the new norm.
Right.
Which I didn't want to do that. Not that I wasn't, looking at it as a standpoint of, hey, I'm not accepting this. But to me, I saw a path. It was a puzzle, and I knew those pieces were out there. I just didn't know personally how to get those pieces. I did a lot of research, and I was fortunate enough to be doing lens therapy at the time, and that therapist recommended me to you, and it made a world of difference with what you were doing as far as your knowledge, the physical work that you did, and the laser. So it's not just the laser, and that's, I think, kind of important to mention. The tool doesn't do everything. The person using the tool has to know how to use the tool to its fullest ability and have a ton of knowledge in addition to the tool.
You made a great point there because it's not just how having the tool, like this particular laser, as I was originally told, this is not just a point and shoot device.
Right.
The protocols of when to use it, when not to use it, and how to use it, that's the protocols that we were speaking about earlier.
Gotcha.
Yeah.
So when people come in with concussions or post-concussion syndrome,
yes,
and probably you've seen a good bit of athletes with concussions, typically, and I can say this from my experience, is the norm is rest, retreat and rest.
Exactly.
Which I don't agree with that. I think being proactive, in having treatment with somebody who knows what they're doing makes a world of difference. So can you describe some of the concussion patients you've had as far as how they were when they came to see you, and what you've done with them versus if they just would have rested and retreated.
Right. Those are the R's that you just mentioned. Usually the old used to be 3 R's to a concussion. Recognize it first, rest it, and then recover. However, there's 2 steps in between that they forgot to mention for a lot of time. Luckily, my mentors and teachers showed me that there's more. So it's more of an active recognition of this is concussion, shut them down for a certain period of time, okay? Then that rest is not just rest, it's active rest. There are therapeutic exercises and nutrition and proper things like screen time, what to do when you come across a difficult situation, you need to shut that down and not push past it. Those are the active rest protocols. Then active recovery is taking it beyond just resting for 10 days and going back to work, okay, or going back to play. So there's much more to it, but they're not difficult protocols. They're overall pretty simple approaches, and a lot of these make sense compared to a traditional model like you were saying either. They recognize it, they shut it down, but there's no active treatment. So that is called a standard management of a concussion. It's not an active management, because there's a lot of things you can do during that rest, during that recovery, and once you go back to play. So that's the big difference. It's a new modern standard on top of the protocols we use with the laser, in addition to the new standard.
All right. Yeah, I'd say my personal opinion on it would be the old guard versus the new thought leaders. And the new thought leaders are more inclined to look at newer therapies or newer technology that maybe the old guard doesn't want to let go of because they're kind of set in their ways a little bit, possibly, or they're just used to doing things a certain way. That's where new technology, new techniques that are been proven, I would say, because one thing I do like about talking with you is you have studies that can back things up. So all of your opinions are based on studies, not just something you Googled online or something.
That's right.
But for example, the laser, there's a lot of companies that make, or there's multiple companies that make that low level laser, but you chose that one because of the all the studies backing it up. So there was like a ton of studies, correct?
There are, yes. When I first started this, there were 2,200 studies 21 years ago. Now there's over 17,000 PubMed articles based on the low-level laser category. So I picked the category of laser first that made sense, which was delivered by my mentor and teacher that he trusted. Then we picked the best company who makes the best low-level laser. And there used to be a ton of them, but now there's only 2 low-level laser companies out there, which is kind of nice. There's Erconia, and then there's the other. And Erconia has 21 of the 24 FDA clearances.
Oh, wow.
That's super trust on top of the PubMed studies. And these are all year-long level 1A double-blind studies.
Right.
The other company doesn't use that level of study and for FDA submission and clearance. Okay. They have a lot of the other lasers have what's called an equivalency. That is like, say, this laser that produces heat is equivalent to a heat lamp, so they can get an FDA clearance for it.
Right. And
but that's nothing different from a French fry warmer at McDonald's.
Right. Yeah.
To be honest.
Yeah, absolutely. The as far as your concussion experience too, you've had concussions.
6.
Yeah.
Documented.
Yeah. So what about, like, so you're 6. Can you talk about the range from like your first one to your last one, and in between, how many years did that span?
Yeah. Well, the first one I actually had 2 concussions within a week when I was 4 years old. Gave me double vision, what they thought was a learning disorder. I was a struggling D student all the way up through my first year of college. And then my first chiropractor, who was the first sports chiropractor in existence, he actually worked with me for acupuncture, neurology, and balance, and fixed my double vision, and I went to a presence-less student after that. And then in 14 years of college, wasn't so hard, because I couldn't read for more than 10 minutes. My last, I'll go ahead and skip to the last big one, I went down at a corner at 40 miles an hour in a bicycle race. I was gone for 5 minutes and 2 seconds, Okay, that was not just loss in consciousness. That wasn't the anesthesiologist, my teammate who was attending over me at the race, didn't know exactly where I was. Okay, and I have very little memory from those events still. I had 11 teammates, and I talked to every single one of them after I got out of ICU for 5 days, and I only remember one conversation out of 11.
Wow.
That's, So, however, I had a laser at the time, so I was able to go from ICU, get a lot of good recovery, and by the way, it's 10 complete fractures that healed up in 3.5 weeks with the help of the laser, and I was able to go back and in a matter of 3 weeks, go back to seeing patients after being in ICU.
Wow. So
that's the range of my experience with that.
Oh yeah, absolutely. So you feel if you wouldn't have had that laser, what, I guess a better question is what, it made a big impact. So like the laser did, being able to use it. If you would have had that laser, no telling how long it would have taken you.
Yeah, and I've had a lot of patients who have come to me 3 months, 4 months after a very similar injury that I had, whether it be from motocross racing, four-wheeler, or from car wrecks, okay? In sports, these are racing trucks. And they've had very similar injuries, and here they are 3-4 months later, and they haven't gotten any better.
Right.
And they also haven't been able to go back to work. So, yes, I was very, very fortunate to be introduced to the laser. I had the laser there with me to able to start mitigating that brain inflammation initially, and mitigating the inflammation that comes in the pituitary, the thyroid, your adrenal glands. All of that stuff is hit, because a lot of people think with a concussion it's just brain, but it's also pituitary injury, thyroid injury. It's the whole gamut from endocrine, and that explains a lot of post-concussive. So I didn't have post-concussive issues because of my early application with the laser, and where I am now. That was 2009, my last one.
Oh yeah, absolutely. I think getting the right kind of help immediately or soon after, there's a lot more benefit to it. But I would say even for people not to get discouraged though, if they don't, because my injury was about 5 years ago, my last injury that did it in for me. So 4.5, 5 years later, with symptoms along the way, I was still able to get results. So I guess
within a short amount of time, too.
Very short amount of time.
Known you that long.
Yeah. So for people that have had it for a while, I would say don't get discouraged. You can still get help. And would it be fair to say that people with a lot of people without permanent damage don't realize that, and they just accept where they're at because they haven't found success somewhere else? Okay, so there's probably a lot of people out there that are like that, I would say.
Everyone out there we're a collection of scars. Okay, but we want those scars to be on the chin, our elbows, things like that too. People forget the scars that are in the brain. Okay, if you're able to return that patient back to reasonable function, which is just recapturing the basics: balance, strengthen the upper extremities, lower extremities, and being able to process that fight or flight or that rest or digest reflex, then they shouldn't have to deal with that for the rest of their life. So that new normal is settling. I don't settle for anything. That's why I went to school for 14 years to learn how to do this properly, because I don't like to just settle for average or status quo. I want to make sure that I can ask the question to see if we can change that or not. Sometimes we can't change it.
And when you also worked on the the vagus nerve, can you talk a little bit about the vagus nerve and how a concussion can impact that, and what role it plays? Absolutely.
So in all standard schools in physiology, they teach us that the 10th cranial nerve, the vagus nerve, controls 90% of the information from the brain gut back to the brain. It's what we call our brain gut axis. They were wrong. It was brain, gut, feet, brain. And that vagus nerve basically is in charge of good communication between the brain, internal organs, and back, but it also deals with balance, strength in the lower extremities, where you are in space. So if that's properly regulated, you can adapt to stress appropriately.
Yeah, when when I first had my injury, I did see and I don't even know what he was. It was a doctor, but I don't know what kind. And looking back on it now, I believe he was most likely a chiropractor, maybe a functional neurology. Would be my guess. And the reason I say that is because when I did go to see him, my symptoms were really bad. But he was massaging or manipulating my neck.
Right.
In the vagus nerve area. And when he did that, my symptoms cleared up immediately.
Right.
So, but I didn't know what it was at the time. Hadn't done the research. I was leaning into more modern medicine and practices at that time. But so I had a functional neurologist, most likely, or a chiropractor who specialized in functional neurology, most likely, right in front of me, but just didn't realize what I had in front of me.
Yeah.
And if I would have stuck with that, I probably would have had a faster recovery or better recovery than I did. So having said that, when people are looking for a chiropractor and looking for, I guess it would be, just trying to take care of their symptoms for concussions, what do you see, I guess, as far as concussions, what are the biggest symptoms that you see people come in for when they're trying to get those treated?
Okay. Well, number one, the most common post-concussive symptom is persistent headache. That's what they perceive. That's what they complain about. But then you go through a good system review, and they're having a lot of issues, endocrine disorder. They're gaining weight for no reason. That's related to pituitary. They still have sensitivity to light, sensitivity to noise. They have frustration, a lot of things like that. So there's a big checklist that they don't realize they're having it, but once you ask them and you do a good history, that they're still checking off those boxes. I say that's related to concussion, absolutely.
Right.
Yeah,
and there's a lot of emotional aspects of it as well too that people don't understand. That people use. I don't think they understand it completely until they start experiencing it. But I would say the anxiety, the depression, those aspects. When you're working on people for concussions, how much of that do you notice clears up?
A good bit of it, because the body is able to multitask better. Okay. So when you're confronted with a stressful situation, either you adapt to it, get things done, and get on about your day. A concussed patient or a post-concussed patient, they're presented with those same stresses that the regular patient is, except they're not able to put those in the right category, because all of the stuff that's supposed to be working in the background, their autonomic system, they're not playing nice with each other. The senses are not playing nice. Their balance is off, all that. So they're not able to recognize that stress for what it is, adapt, and get on about your day appropriately. That's the main differences. Right. And that's still a concussed or persistently injured patient.
Right. And would that would a lot of that, or could a lot of that be attributed to the fight or flight that is just out of whack?
It's a good bit. That's where we always start. We always start with balance in your brainstem, cerebellum. Then we look at that fight or flight on the first visit, whether they're switching well. And are they adapting to fight or flight, which is the sympathetic system, or are they actually going back into parasympathetic rest and digest appropriately?
All right.
Yeah.
So I guess the average person, they get a concussion, they go through the normal stages. Athletes typically are going to get, you can notice concussion a lot faster because you're there, as a sports chiropractor. So I guess, can you describe like one situation where you had with an athlete where maybe they had an obvious concussion to you? Because I think what happens is I've even noticed this in I watch soccer. I've noticed it in major games where a keeper actually in a Champions League game final was concussed, and he got struck in the head with an elbow, and 2 goals were scored off of him. And you could tell just by watching, and this was a world-class keeper, and you could tell by watching him, I could have done a better job as far as stopping the ball. Yeah, he looked just awkward, almost like he missed on purpose. the 2 shots that were scored on him afterwards. So being there firsthand with athletes that do get injured and have a head injury, how fast do you notice them coming or improving while on the field versus then the treatment you give them afterwards? How long does that usually take?
Well, in neurology, sports medicine, diplomate in sports, we are trained to notice that right away. And we call it unraveling. Their nervous system is unraveling. They're not able to multitask immediately, and that's why the SCAT-6 concussion exam is done initially on the field and then off the field as well, to make sure that that person is concussed and they're definitely not going back in that game. And then you mentioned, what have I noticed as far as athletes initially and then even long term? This, when one of my recent teams that I was with, we had a patient came in, he complained of shoulder pain, okay? But he also had a bloody steering wheel outline on his forehead. And I'm like, what happened? He goes, well, I didn't tell anybody, doc, but I got to tell you now. I, totaled my car yesterday at 60 miles an hour and I wasn't wearing my seatbelt. I hit a parked car.
Oh, wow.
I'm like, okay. So this is Monday. I see him and he didn't even realize he was concussed. He was such a fit athlete, he was just going through the motions of practice, going to class. I said, well, how many hours of sleep have you had? He goes, 6. Okay. Since when? I've only had 6 hours of sleep since last Thursday.
Wow.
And then, here he is Monday. And so that's an initial concussion observation too. The other one, I had an NFL player, 6'9", 340 pounds, a 6-year veteran. And that's a long time as an NFL lineman, okay? He came in for his turf toe. Couldn't get rid of it. He was cut from an NFL team because he could only play on one side of the field. We noticed that it wasn't his turf toe that was keeping him off balanced, having his right foot back. It was the concussion. And we identified those post-concussive issues, and he was going, well, this makes sense. This was really super smart guy, super fit guy. He was in the NFL for 6 years for a reason, because he took really good care of himself, ate super clean, and he knew this wasn't right. He just didn't know what to do about him.
Right.
So after he got cut, we cleared all this stuff up, and he went back and played 2 more years in the NFL and then XFL and then retired. He's now one of our local O-line coaches.
Oh, wow. Very cool.
He didn't realize he still had concussive type issues.
Right. Oh, yeah, I can definitely see that.
So there's the acute observation, and then there's a chronic that's post-concussive, and his last concussion was 2 years before that.
Wow. And what about, you talked about the guy that mentioned the athlete that got into the car accident.
Yes.
Which kind of makes me think about whiplash. Mm-hmm. And a lot of people talk about having whiplash from a car accident or something like that. Is it fair to say if you have whiplash, you have a concussion?
It's very documented, okay? There are hundreds and hundreds, actually thousands of patients that we've tested over the years after having whiplash. There's always some type of concussive component. Most of it's mild, but then they have, the cervical injury, a shoulder injury from the lap belt. They have one from the lap belt or the shoulder belt here. Then they have the neck issues, and then they completely forget to even ask and treat the headache, the dizziness, the blurred vision, the irritability, the sensitivity to light, the sound, the being more emotional, crying for no reason. All of that stuff kind of gets lost in the neck pain whiplash world. Right. Yeah. But luckily we get to do both now.
Oh yeah. Mm-hmm. And how does the neck play into treating concussion?
Okay. Just for instance, the male athlete has less incident of a concussion because of the stronger neck musculature. Female athletes have less muscular control of the neck, very, very fit people, but they don't have as much shock absorbing ability, okay? So that's where it comes into play. The neck is basically, if you have a good cervical curve or lordotic curve, they call it, you have a good shock absorber. When you get hit, that's a better shock absorber, and the brain doesn't get injured as much.
Right. Yeah, and I could
That's the difference.
Yeah, because when I was striking the back of the head, I didn't see it coming, so I didn't prepare. My body didn't tense up a little bit for it, and it was just completely loose. So when I got hit, so I can definitely see that. And I think people, they hear whiplash, it's automatically car accident.
Right.
But what are other instances where somebody can get whiplash with just simple things?
Yeah. From collision sports, and even basketball has a lot of collision in there, although it's related as a non-contact sport, or limited contact, I believe. But any kind of collision on the field, whether it's soccer, baseball, lacrosse, that's a very, very intense sport. So you can get it there, but you can also, from equestrian sports, you can get hit from the side, you can be thrown, the neck can move around, and if the neck accelerates, the brain accelerates and bounces off the inside of the skull. So, and then other slip and fall. You can have your feet slip out from you in the mud, land on your tailbone, and issue with the neck and bruise the bottom part of your brain. So you don't have to hit your head to have a concussion. You can slam your body hard enough, have whiplash type effects, and be mildly concussed.
So especially a lot of sports with shoulder-to-shoulder contact, stuff like that, very easy to get it. And not even realize that, especially if it's repetitive. You're constantly just getting that shoulder-to-shoulder contact and not even realizing you're just getting, I guess, would it be micro-concussions?
Yes. Mm-hmm. Okay. And even micro-concussions, you have your initial concussion, that's one thing. But then if you have a secondary, tertiary, or quaternary type of concussion, those concussive effects, injury to the brain, go up exponentially. So that's why one of the reasons we shut somebody down within 10 days, 2 weeks. And the younger they are, the longer we shut them down, because we don't want them to have a second, third, or fourth type of concussion in a certain amount of time. Right. So even micro-concussions, there's a lot of different sports, there's a lot of different work activities that people get a lot of these micro-concussions, such as veterans. Anytime that has a mortar go off, an explosion nearby, whatever, that brain is micro-concussed. We have to treat it accordingly.
And touch on food for a second. What I think a lot of people miss the boat on food and its relationship with concussions and how, well, just brain health in general, but especially if you have a concussion, if you're drinking alcohol a little bit or even a lot, the foods you're eating, the processed foods, the sugars that are causing inflammation. Can you talk a little bit about how food can affect the brain and especially people with concussions?
Absolutely. And this, through the standard school of dietetics, is not usually addressed, but in physiological nutrition, that one of the things that even a general chiropractor can help guide you in that right direction. There are, as far as PubMed studies, there are 10 ways to concuss the brain over again. Okay. The first one is the physical concussion. The other 9 are all dietary related. And since you mentioned alcohol, that's the sugar category. And I'll explain that one, and then we can explain the other ones another time. But alcohol kills brain cells. It causes inflammation to the liver and in the brain. So you're concussing your brain over and over again by eating those foods. And the other 8 categories have similar effects too. They all stress out the endocrine system. They stress out the physiologically and brain energy production system to where they can again, they're harmful. They concuss the brain. They can slow recovery or, cause everything to run amok.
A lot of it, I guess, is brought back to inflammation. Just the things that cause inflammation.
Exactly.
So because one thing I did notice as that you mentioned when you were treating me was just, they're talking about the inflammation and how the inflammation has gone down. It's basically, a lot of it is getting down to controlling inflammation. I would say.
So, and that's one of the things that we want to be able to do with the low-level laser, with the nutrition, very specific nutrition, all based on science, not just hearsay, is to mitigate that inflammation. The sooner you can get the inflammation down in the brain and the liver and the body, the easier they're going to recover, and they're also going to be more functional long term after that. We don't want just partial recovery and then that person is partially disabled. And disabled is just not being able to handle appropriate stress in the environment.
Yeah. So as far as concussion, or having a concussion, what would you recommend as far as just the simple things that people can do just to help themselves at home? Not therapies or anything like that, but maybe just lifestyle habits as far as like bedtimes, consistency, routines, obviously cutting out things that cause inflammation. What would you say would be a very good habit or rule to follow?
The number one thing is sleep hygiene. Okay, and we hear about sleep, but good hygienic sleep means that is the brain able to actually rest, repair, detox, and recover properly. So the easiest thing I would explain to this, and this is actually based on about 20 years ago, they figured out that ladies who work the graveyard shift have the highest incident of breast cancer and death from breast cancer of any population in the world. That got everybody's attention, but they didn't know why. So sleeping for at least 9 hours after a concussion for a while, even this is like 2-3 months later, being able to really recapture your sleep, because at 6 hours of sleeping in total darkness, that's the caveat too. Once those 6 hours happens in total darkness, sleeping in a cave, then the mitochondria start producing their own melatonin. And since we sleep in 9-minute cycles, sleep, not 6, not 7.5, but sleep at 9 hours. Then, after you're concussive and fully recovered, then you can go back to sleeping on the average of 7.5 in total darkness. That's the best recommendation we can give.
And I can see that, because sleep, I can say personally, has had the biggest impact on me. Throughout the whole process of being very bad to where I am now, I definitely noticed sleep along the way. The more I slept, the better I did. So without good sleep, I wasn't getting that healing time.
A sleep deprived brain is a toxic brain. Number one fact. Hippocrates first noticed this thousands of years ago. He measured that their brains actually shrank when they're asleep. With functional MRI nowadays, we've actually proven that. So when you sleep properly and you don't have a lot of stimulation from light, different things too, keeping you awake, keeping you in fight or flight, then the brain can actually shrink. The cerebrospinal fluid can flow in and out of the brain properly, bring nutrition in and bring toxins out. So the brain can detox and recover properly, and you get to produce what's called human growth hormone at night, which is your rest, repair, detox, fat burning, go out and kill it and bring it back chemical.
Gotcha. Okay. And then so to wrap this up, I was going to say, just if you could, where are you located and how would people be able to get a hold of you if they want to reach out?
The easiest way, I am located right here on Valleydale Road, just south of Birmingham, in Birmingham Unincorporated near Hoover. And just reach out to drdavidtodd.com. So drdavidtodd.com, or call me at 205-444-9484. Text is best, and then leave a message if you need.
All right, and I can definitely say personally, I'm not from this area. I actually traveled here and stayed for a few months. I know obviously not everybody can do that, but if you can, it's definitely worth looking into to do that, because it was well worth the trip, and I'm absolutely glad I did. So for anybody watching the video, I would say, or listening to this, I would say definitely, just because somebody is not in your area, I would say that it's not, sometimes there's a way, and I understand sometimes there's not, but many times there are. So definitely look into it, traveling.
And even if you can't travel here for, say, 4-5 days at a time, spend a week here, I might know of someone out of this area that might be able to help you. That is one of the things we provide.
All right.
Other good trusted practitioners and referrals.
Gotcha. All right, sounds good. And how long would you say the average, how many sessions would you say the average concussion takes?
Significant brain injury concussion, whether they're like in ICU and trauma, ICU, that's about 12. Okay. Average visits about 6.
Okay, so if someone did want to travel, they could plan on 6 to 12. Obviously, they can contact you and have a discussion on what might be better for them as well.
Yeah, but most of them are usually around 6 treatments.
Gotcha. All right, well, thank you very much. I appreciate the time.
Thanks for having me.